We are going to discuss the anatomy of the face and the neck for the next 9 or the 10 lectures. I'm Dr. Ibrahim Faleh from the Department of Surgery, Basra Medical College. The first lecture today about the anatomy of the face, and we are going to discuss here the scalp. So, scalp. The scalp is the part of the head that extend from the superciliary arches anteriorly to the external occipital protuberance and superior knuckle line posteriorly. So it is extended anteriorly from the superciliary arches to the external occipital protuberance and the superior knuckle line posteriorly. Laterally, it continues inferiorly to the zygomatic arch. These are the boundary of the scalp. Anteriorly start from the superciliary arches and posteriorly to the external occipital protuberance and superior knuckle line. Laterally, it continues with the zygomatic arch. These two pictures show the anterior, posterior, and the lateral extent of the scalp. So it is start from the superciliary arches anteriorly and here posteriorly to the occipital bone to the or protuberance and the superior knuckle line. Laterally, it will continue with the zygomatic arch. Scalp. What are the layer of the scalp? The scalp is a multi-layered structure with the layer that can be defined by the word itself. How many layers of the scalp? There are 5 layers. One can easily remember the layer of the scalp by remember the letters of the scalp itself, the word scalp itself. So the layer can be summarized as SCALP, scalp. The first layer is the skin and subcutaneous tissue. This is the superficial or outer layer. The second layer is the C, connective tissue, dense connective tissue. And the third layer is aponeurotic or the fibrous layer. Aponeurotic layer means fibrous layer, or it is also called galli aponeurotica. The third layer is the loose connective tissue, and the fifth layer is the pericranium, which is a part of the skull, the outer layer of the skull. So there are 5 layers. Start with the skin, dense connective tissue, aponeurotic layer, loose connective tissue, and the pericranium. The first 3 layers are tightly held together. They attach firmly to each other to form a single unit. This unit is sometimes referred to as the scalp proper. And if the tissue is torn away, this is if not is proper is if the tissue is torn away during a serious scalping injury, these firm layers will be lacerated together. The first layer, 3 layers, they are the skin and subcutaneous tissue, the dense connective tissue, and the aponeurotic layer. These are called the scalp proper. Scalp proper mean the main layer which form the bulk of the scalp. This is because the fifth layer, which is the loose connective tissue, and the pericranium or the last layer, part of the skull. So they are thin layer, not form the main bulk of the scalp. The main bulk of the skull form from the first outer 3 layer, forming a single unit, one unit, when lacerated as a single unit during injury, called the scalp proper. These pictures show the layer of the scalp. The first layer is the skin, and the skin of the scalp is a hair-bearing skin, hair of the scalp. The second is the dense connective tissue, and here in the dense connective tissue, as we see, there are many arteries and vein and nerve. So it is a highly vascular layer. The third layer is the aponeurotic layer. This is the green line, aponeurotic layer. And these three layers form the main bulk of the scalp, or what we call the scalp proper. The scalp is a highly vascular structure supplied by many artery and nerve and vein, and it is with a rich nerve supply, sensory nerve supply. The main artery, as we said, and the vein are located in the dense connective tissue in the second layer. For that reason, any injury, any laceration to the by any trauma to the head injury or trauma to the scalp, so it will result in a profuse and severe bleeding. This is the fourth layer, which is a loose connective tissue. Here, the loose connective tissue, and the last layer, which is a part of the skull, we call it the pericranium. These are the 5 layers of the skull. Here, in this below the pericranium, we have a venous drainage of the brain or the skull, which is called the venous, the sinuses or cavernous sinuses. And in the loose connective tissue on aponeurotic layer, we have a valvulus, as we say later, the valvulus vein, which connect the vein of the skull, the superficial vein of the skull, with the venous sinuses or cavernous sinuses of the brain. And these valvulus vein we call emissary veins. The importance of the emissary veins that connect the superficial vein of the skull to the venous drainage of the brain and inside the skull. It is a port of the infection. Any infection in the skull can transmit inside the brain, inside the skull, through these emissary veins. Later in the next lectures, we know what are the name of the emissary veins and their importance. So these layers of the scalp easily to be remembered from the word of the scalp. The main blood vessel, the main veins, artery, and the nerve are we call the neurovascular bundle, situated in the second layer of the scalp, in the dense connective tissue. In the third and the fourth, we have a valvulus vein, which connect the vein of the scalp, the superficial vein of the scalp, to the cavernous sinus of the brain. This vein, which is valvulus vein, is called the emissary veins, which are the site of the could be transmit or the route of the transmission of the infection from the scalp to inside the brain. So we call it these layer as a dangerous layer or the dangerous zone. Now we are going to discuss the layer of the scalp thoroughly. First layer, as we said, the skin, which is thick, hair-bearing, and contains numerous sebaceous glands. Sebaceous glands, الغدد الدهنية, which is situated near the hair follicle and attached to the hair follicle. The second layer, which is the dense connective tissue, from its name, the dense. The thickest layer of the scalp is the second layer, which is the dense connective tissue. It is a fibrofatty, so it consists from the fibrous tissue and the fatty tissue. The fibrous septa uniting the skin to the underlying aponeurosis of the occipitofrontalis muscle. Occipitofrontalis muscle is the main muscle which found or present in the skull. From the name, it has a two belly. Belly يعني شريط. It has a two belly. One belly originates from the occipital bone. The second is from the frontal bone. So it has occipital belly and the frontal belly. For that reason, they call it occipitofrontalis muscle. The numerous arteries and veins are found in this layer. as we said before, the main arteries, vein, and the nerve of the scalp are found in the second layer, the connective tissue layer. What are the origin of these arteries which supply the scalp? They are branches from external, mainly external, and internal carotid artery. A free anastomosis takes place between them. In the neck, the common carotid artery will bifurcate to form the external and the internal carotid artery. From the name implies that external carotid artery will supply the superficial part of the face and the neck. The main artery of the face outside, external of the face and the neck, is the external carotid artery. The internal carotid artery, as the name implies, it will enter internal. It will enter the brain, the skull, to supply the skull and the brain, inside the brain. So the blood supply of the scalp mainly from the branches from the external carotid and the internal carotid, and of course there is a free anastomosis or communication between these two arteries. The third layer, which is the fibrous layer or called aponeurosis, another name epicranial, is a thin tendinous sheath that unite the occipital and the frontal belly of the occipita frontalis. So the main function of the third layer, which is a thin tendinous sheet, for attachment of the two belly of the occipita frontalis muscle. The lateral margin of the aponeurosis are attached to the temporal fascia. The skin, dense connective tissue, and the aponeurosis or epicranial, we call it the scalp proper because they are the main bulk of. The fourth layer is a loose areolar tissue, thin layer, occupy the subaponeurotic space below the third layer, subaponeurotic space, and loosely connect the epicranial aponeurosis to the periosteum of the skull, or we call it the pericranium or the fifth layer of the skull. This areolar tissue contains a few small arteries, but also, as we said, contains small important emissary veins, valvulus vein. The emissary veins, the valvulus veins that connect the superficial vein of the scalp with the diploic vein of the skull, bone, and the intracranial venous sinuses. So it connects the superficial vein of the scalp with the vein inside the brain. For that reason, we call the dangerous layer of the scalp because it contains the emissary veins. So any infection or any inflammation of the scalp can be transmitted to inside the brain, inside the skull, through these veins. So it acts as a portal for transmission of the infection. The fifth layer is the pericranium. Actually, the pericranium is a part of the skull, of the bone, which is a periosteum covering the outer surface of the skull bone. These are the fifth layers of the scalp. The pericranium اللي هي part of the periosteum of the skull. I think it is easily to be remembered the five layer of the scalp from the word scalp. The muscle of the scalp, as we said, the main muscle of the scalp, which is found in the third layer or attached to the fourth layer by the epicranium, is the occipitofrontalis muscle. As the name implies, it has a two belly, the frontal belly from the frontal bone and occipital belly posteriorly. And they attach to the aponeurotic tendon, epicranium aponeurosis, connecting the two. Nerve supply of the occipitofrontalis is the facial nerve. Facial nerve is the 7th cranial nerve. We have 12 cranial nerve. The facial nerve is the 7th cranial nerve. Since the occipitofrontalis is one of the muscle of the facial expression, and all the muscle of the facial expression are supplied by the facial nerve. So the nerve supply of the occipitofrontalis muscle is the facial nerve, the 7th cranial nerve. Action of the occipitofrontalis move the scalp on the skull and raise the eyebrows. The muscle of the facial expression, there is a lecture for the muscle of the facial expression. We are going to discuss these muscles later in the next lecture. المصل اللي هي responsible of the بالعربي تعابير الوجه، واحدة منها هي الأوكسيبيتافرونتاليس. All the muscle of the facial expression are supplied by the facial nerve. Regarding the sensory innervation of the scalp, it is from two major sources. The sensory innervation of the scalp from main two sources. We have cranial nerve or cervical nerves. Depend on whether it is anterior or posterior to the ear and the vertex of the head. What is the vertex of the head? It is the line, imaginary line, that extends between the two ears at the top of the skull. This is the vertex of the skull. The upper part of the skull line the upper part of the skull or the scalp that extend between the two ears. So the innervation of the scalp depends on whether the half, whether anterior to the vertex or posterior to the vertex and the ear. Anterior to the ear and the vertex, the scalp is supplied by four branches of a trigeminal nerve. The trigeminal nerve is the 5th cranial nerve, while the part of the scalp posterior to the ear and the vertex are supplied by 4 divisions also of the cervical nerve, spinal cutaneous nerve from the cervical 2 and 3 nerve. So anterior from the trigeminal, posterior from the cervical branches or spinal cutaneous nerve, which is a branch from the cervical 2 and 3 root nerve. What are the 4th branches of the trigeminal nerve which supply the scalp anterior to the ear and the vertex? There are 4. The first is the supratrochlear nerve. The second is the supraorbital nerve. The third is the zygomatico-temporal nerve. The 4th is auriculotemporal nerve. These are the branch of the trigeminal nerve, the 5th cranial nerve, which supply the scalp anterior to the ear and the vertex, while the branches of the cervical nerve, C2 and 3, which supply the vertex behind the scalp behind the vertex, they are a great auricular nerve, lesser occipital nerve, a greater occipital nerve, and the 3rd occipital nerve. 4th from the cervical branches which supply the scalp behind or posterior to the vertex and the ear, and the 4th nerve from the trigeminal, the 5th cranial nerve, supply the scalp anterior to the ear and the vertex. This diagram shows the nerve. Cervical and the branch of a trigeminal nerve, the sensory innervation of the scalp. Now to the arterial supply of the scalp. We say that the artery supplying the scalp are branches from the external carotid artery, and the main blood supply of the scalp, the majority or the main volume of the blood coming from the external carotid, or branches, small branches from the internal carotid. The ophthalmic artery of the internal carotid artery, only the ophthalmic artery, which is a branch from the internal carotid artery, share in supplying the scalp by blood supply, while the main blood supply through the external carotid artery. The external carotid artery give 7 branch in the neck and the face. The main branches which supply the scalp is the superficial temporal artery, the maxillary artery, and occipital artery. Yes, these are the arteries which supply arterial supply of the scalp. Branches from the external carotid, as we say, the occipital artery, posterior auricular artery, and the superficial temporal artery. These are branches from the external carotid. مهم واحد يحفظ هاي البرانشز. External carotid artery branches which supply the scalp is occipital artery, posterior auricular artery, and the superficial temporal artery. The internal carotid artery اللي هم branch from the ophthalmic artery, they are supratrochlear artery and the supraorbital artery. So the blood supply coming from both external and carotid artery. External carotid artery share 3 arterial supply, while big arteries, main arteries, while the internal carotid artery only small 2 artery, which they are supratrochlear arteries and the supraorbital arteries. Because the main arteries, the main big arteries of the internal carotid artery enter the inside the brain, inside the scalp, not outside. This picture shows the arterial supply of the scalp from both external and internal carotid artery. Venous drainage of the scalp, we know the sensory nerve supply, we know the arterial blood supply. So now to the venous drainage of the scalp. The vein draining the scalp follow a pattern similar to the artery. So the name of the vein are the same as the name of the artery. Of the deep part of the scalp, as we said, we have the deep part of the scalp, the third and the fourth layer of the scalp. We have the emissary veins that communicate with the dural sinuses, or here venous sinuses inside the skull and the brain. So we have the same name of the artery. And as well as the emissary veins which communicate with the dural sinuses brain. Lymphatic drainage of the scalp. This is very important, مفيدة اللي نعلمها الصف الرابع أو السادس, how we examine for lymphatic drainage of the scalp. Lymphatic drainage of the scalp generally follow the pattern of the arterial distribution. And you go and found with the arteries. The lymphatic in the occipital region initially drain to the occipital node, which drain to the upper deep cervical node. So the lymphatic drainage of the scalp follow the arterial supply of the scalp. نحكي على الفينس drainage of the face and the neck, بنحكي على lymphatic drainage later on in next. Lymphatic from the upper part of the scalp drain into 2 directions. Posterior to the vertex of the head, they drain into the mastoid node. Mastoid node situated near the mastoid process of the skull. Anterior to the vertex of the head, they drain into the preauricular and the parotid node. هنا لازم واحد يعرف lymphatic drainage of the face of the neck شلون مترتبة. We have two groups of the lymph node in the face and the neck. The first group we call it circular, and the second is the longitudinal. What is the circular? It forms a circle. It starts below the chin, below the mentum, we call it submental. And then another group, which is the next near group, below the angle of the mandible, we call submandibular. Then the preauricular. This is the circular group. I talk about the circular group now. Preauricular in front of the ear. Then the postauricular اللي هي صايرة posterior to the ear, and then the occipital. من يجي واحد يجر خط بينات submental, submandibular, preauricular, postauricular and the occipital from the two sides, from the left and the right, will form a circle. So they call it the circular group of the lymph node. اللي صايرة جوا المنتم جوا الماندبل هي جوا الchin, we call it submental. اللي صايرة جوا angle of the mandible we call it submandibular. اللي صايرة in front of the ear اللي جواها صايرة parotid gland salivary gland. تالي نحكيها عن salivary gland we call it يا preauricular أو الاسم الثاني parotid. اللي صايرة behind the ear posterior to ear postauricular. اللي صايرة هنا يم الأوكسبت يم الأوكسبيتال protuberance يم السوبريور نكال لاين occipital. From both sides, when we draw a line, they form a circle. For that reason, we call it the circular group of the lymph node. Where is the longitudinal? Here we have a big muscle in the neck. Big muscle, we call it the sternocleidomastoid. The sternocleidomastoid. من اسمها sternocleidomastoid. So the origin from the sternum and the clavicle. Sternocleido. And the origin here in the mastoid process. This longitudinal muscle, high muscle, the big muscle, the biggest muscle of the neck and the strongest muscle of the neck, we divided it into the 3/3. نقسمها إلى 3 أثلاث. upper third, middle third, and the lower third. So the longitudinal group of the cervical lymph node يقسمونها إلى upper group اللي هو موجودة بالupper third والmiddle group and the lower group. وهاي الليمف node when situated along the medial border of sternocleidomastoid. هاي يسمونها اللونجيتودينال واللي حكيناها قبل شوية هي السيركولار. هاي وين الصب؟ هاي يسمونها السوبرفيشال. وين الصب الديب وين صايرة؟ اكو مصل هير هنا يسمونها السكالين مصل والجاجولو دايجاستريك. الصب بالديب بالدايجاستريك والنود along these muscle and then to the deep cervical lymph node اللي موجودة هي بالسوبرا and infraclavicular lymph node. supra and infraclavicular lymph node اللي صايرة below and above to the clavicle. نعيد مهمة cervical lymph node لأن تسألون بها حتى صف سادس احنا نسألهم والرابع. فهي موجودة we have two group we have superficial and deep. السوبرفيشال نقسمها إلى circular و longitudinal. السيركولار اللي هي submental اللي جوا المنتم جوا الانجل of the mandible this one we call it submandibular اللي صايرة فوق الباروتيد in front of the ear preauricular or parotid اللي ورا الاير posterior to the ear postauricular and on the occipital bone or occipital nuclei is the occipital lymph node. These are the circular group. Longitudinal group along the medial border of sternocleidomastoid. وقلنا تتقسم. This is another picture for the cervical lymph node. This is the submental, submandibular, preauricular, postauricular, and occipital, and these are the longitudinal group along the medial border of the sternocleidomastoid.